Estás viendo Canal América, televisión dominicana para el mundo.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
So welcome to a Time for Truth show. And I think a lot of you know I'm Cuban born. And today, the last few days in Cuba, the people are protesting for liberty. So that's a good thing. And today we have something else which gives liberty, and that's being free from pain. Today's show is on pain, discomforts, nervous problems of the body. And we have an expert. We're very lucky to have an expert here with us today. And I want to tell you a little bit about our guests, Dr. Dimitrios Kostopoulos, a board-certified doctor in clinical electrophysiology and world-renowned expert in myofascial pain. He's the co-founder of the family of what's called the hands-on companies, including hands-on EMG testing, hands-on physical therapy, hands-on diagnostics, and hands-on seminars. Dr. Kostopoulos has more than 30 years of clinical experience and over 20 years of experience in electrophysiology testing, and received his PhD and master's degree from NYU University. He earned a second doctorate of science degree from the Rocky Mountain University in clinical electrophysiology and received his MD degree from the University of Health Sciences. He serves as a clinical affiliate professor at Florida Atlantic University and is adjunct faculty member of Springfield College in Springfield, Massachusetts, very close to where I grew up in Connecticut. There he teaches clinical electrophysiology. The doctor is a trusted expert and teacher and member of the Specialization Academy of Contact Experts for the Electrophysiology Board. He does and supervises the board exam of the American Board of Physical Therapy Specialties and currently serves as elected secretary of the Academy of Clinical Electrophysiology for the American Physical Therapy Association. He is the editor of the diagnostic section of the Journal of Bodywork and Movement Therapies. Dr. Kostopoulos has extensive training and teaching experience in many different areas of manual therapy, and he delivers training all over the world with emphasis in manual therapy, on trigger point, myofascial, neurofascial therapy, and manipulation. He has taught thousands of his participants in his courses throughout the globe and is the recipient of numerous business and humanitarian awards. And with all that he does in his profession, he somehow has time that he makes to help humanitarian for our community. He's amazing, amazing man. Dr. Kostopoulos continues to work closely with businesses and patients to improve knowledge and quality of care, improving the lives of all of us. And so I want, engineer, if you can put him up on the screen, and I want to welcome to a Time for Truth show, Dr. Dimitrios Kostopoulos.
Thank you. Dr. Fialkov, my goodness, it was such an amazing introduction. I thank you for your kind words. Thank you so much.
Well, you're quite welcome, but they're not kind words. I was trying to see what I could cut out of your bio, but I decided that the people should know today when you're giving out the advice that you're really quite well known and expert in your field. So I wanted to ask you, what is it that made you in your life choose this as your profession, your mission? What is it that inspired you?
So, listen, I'll tell you a story. My journey in deciding to engage in the medical professions, it started for me when I was 5 years old. I was born in Greece. I grew up as a kid there, and at age of 5, I was diagnosed actually with tuberculosis. So I was in a pediatric hospital in Athens, and it was Good Friday when I felt a lot better and more recovered. And through that time, I was admiring so much the healthcare professionals that they cared for me so well. So now I want your viewers to imagine me, a little 5-year-old kid, being outside in the balcony of the hospital, watching the Good Friday processions, where the churches, the different churches, all the people who follow that church, they go out in the streets and they sing and they really enjoy the celebration of Good Friday, right? And pay their respects. And during that moment, I felt so inspired that I said, you know what? What these people did for me, the help that they gave me, somehow I want to be like these people so I can help others. So that journey started since I was 5 years old.
Amazing. This is like from very early age. Wow. And
Sometimes
so, go
I
ahead.
wanted to say that sometimes decisions that we make, even at an early age, define what we do, define sometimes what we end up becoming. So we got to make sure that we make the right decisions.
Very, very good point. It's so true. You know what you said, because ever since I was a little boy, the things that I'm doing now, I wanted to help the world, and I became a doctor like you, and here we are on this show now, A Time for Truth, doing what we looked at when we were little kids, and now we're older kids, still playing the same game. But I wanted to, because I want to take advantage of the time we have you. So I wanted to ask you, so many people out there who's suffering. So what I wanted to ask, so you could help the people watching this show, what are the different symptoms that you treat that are bothering people in our New York area, the whole world actually, and what do you do about that? Go ahead, please.
Yeah. So here's the thing. We live fast-paced lives. People are working hard. People are engaging in many activities. Some people sit for too long. Some people are running around for too long. So our bodies, they are like machines. So the bodies get to sometimes break down the same way a car breaks down, the same way the body can break down, and you can feel pains and aches in your neck, in your back, in the different joints in the body. So when someone feels pain, there might be various reasons why they feel that pain. And identifying the reason of the pain can help us manage that patient better, help us find the right solution for the patient. If we don't find the right reason for the pain, we'll give the wrong solution. So it's like the analogy, if somebody's car stops running and they are looking with a problem in the engine, meanwhile they forgot to put gas in the car. So if you are looking for the wrong problem, you're gonna find the wrong solution. So you gotta look at the right problem to find the right solution. So here's the thing. To identify the right problem, you need to have in your hands the proper diagnostic tools to be able to do a diagnosis, to be able to identify the right problem. So what I do is I utilize advanced technology that is non-invasive technology, that does not use radiation. It doesn't use anything that can harm the individual. These are nerve tests that we do. We use ultrasound waves, like sound waves in the body, to be able to look inside the body. So I can have a patient next to me, I can put on their shoulder that feels pain, let's say, an ultrasound machine, and I can show them on the screen how their shoulder looks inside. And then I can identify what is the exact cause of the problem, and we can direct then the patients to the proper treatment. And most times, if we find the problem early on, that can be treated with physical therapy, which is non-invasive, without medications, without surgeries, and using natural means to treat them.
That's quite, it's amazing. Because I know that in my own practice, I've had patients who had surgery. Unfortunately, they're still having residual problems. If there's someone out there watching this show, Dr. Kostopoulos, and they've tried different things, they've had surgery, are they still a candidate to see you?
Yes, they are. And you know why? Because what happens many times when we don't identify, when somebody does not identify the cause of the problem, then the people get disappointed because they continue feeling pain. So what do they end up doing? They start taking painkiller medications, and they take opioid medications to deal with their pain situation. And people, because opioids become very, very addictive to people, we start having a huge opioid addiction in the country. But if somehow we identify the right problem, the right cause of the problem, we can identify and give to people solutions so they don't have to start taking opioids, becoming addicted to them, and sometimes even dying from them. So
Absolutely.
this technology that we have can help curb the opioid crisis, which is an amazing thing.
You know, it's interesting how sometimes things that are so simple in terms of the thought process and are so logical, and you know, you say, wow, we should apply this more often so we could solve some of these maladies that are going on in society, like you said, with the opioid crisis and treating the pain naturally or with your treatment. So I wanted to ask you, because I'm sure that the viewers are interested. So you talked about the ultrasound. Do you do some type of physical manipulation, or do you give stretches or exercises? How do you treat in general? I know we can't go into it all, but how do you treat in general for these patients?
Sure. So the first thing is we get from the patient all the data about what they think that is wrong with them, what happened exactly. So that's the first thing we do. The second thing we do is, based on the information that the patients have given us, we perform the proper diagnostic technology so we can look inside the patient's problem and identify the right solution. Once we have that, we create an appropriate treatment plan, an appropriate management plan for the patient that includes 90% of the time physical therapy solutions. Solutions, in other words, that do not require medications, with specific techniques of movement, mobilization, manipulation techniques, stretching techniques, strengthening exercises, and advice that we give to the patients on what to do and what not to do in terms of their bodies. We help the patients completely resolve their pain problems. And actually, this approach, utilizing this specific paradigm that I explained to you, has been documented with research study that we published last year in 465 patients, that it has 62% greater effectiveness than if we don't follow this protocol. So,
Wow.
yeah.
Amazing.
Thank
It's
you.
totally amazing. Do you work frequently with orthopedists, or most of the time, or how does that work?
Sure. Of course, orthopedic doctors and primary care doctors, they trust upon us to help their patients, especially those who have pain problems. Many of our patients come as referrals from physicians. There are, I would tell you, because no exaggeration, we've been doing physical therapy now and diagnostics for a long time. I started, uh, uh, I opened my office in 1992. So it's been
Wow.
quite a few years. So I've treated over 160,000 patients through the years. Um, and But many people come directly to us because they hear about us, or friends and family, people who were suffering for many years from problems, and then all of a sudden they came to us, they find they were cured from their ailment, and then they go and they send their friends and family to us. And especially now with the with COVID, with the pandemic, there are a lot of situations that people have pain problems and nerve problems related and not related to the pandemic, actually.
Yes,
I'll elaborate.
you're actually touching on a point that I did want to cover, and I'm glad you're getting into it. So my question for you that I'd like you to discuss is, with COVID, it seems like there are I've seen different pains or different nerve changes that occur. So I wanted to ask you to discuss that, how that's happening, what the theory or the discoveries have been, and how the viewers can do something maybe even at home with what they're doing, or their diet, or a supplement, and obviously also seeing you or whoever appropriate. So please discuss that.
Sure. So we're going to divide the problem in two types of patients: patients who actually got COVID, and people who did not get COVID. So let me talk first about people who got COVID. It has been documented in the literature, and we see it time and time again, that COVID has two physical consequences in the body, amongst other things. One is that creates pain symptoms similar to fibromyalgia, like unexplained pains and aches in various parts of the body, pain that can be traveling from place to place. That's the first thing. The second thing is numbness and tingling associated with the phenomenon of demyelination. And let me break it down very quickly for the viewers. I'm going to show you this pen right here. Let's suppose that this pen is a nerve. Around the nerve, there is a covering, like this white thing. This covering is called myelin. This protects the nerve. Patients with COVID, it has been shown that the myelin strips away. So the nerve becomes exposed and becomes more vulnerable, and people start feeling numbness, tingling, pain sensation. So what we do in these cases is, first of all, we do a nerve test to specifically identify if the patient does have demyelination. And then there is a set of physical therapy, manual therapy techniques called neurofascial mobilization techniques that can help recover the myelin around people's nerve. Okay, so that is for people who got COVID. People, though, who did not get COVID, because of all of these restrictions we had around the society, people stayed a lot at home. They were not going to work. They were working from home in front of a computer. The habits around how they treated their body changed. They were more stationary. They were more sedentary. So the lack of movement started creating pains in the joints, weight gain to people, stiffness in the muscles. So absolutely, we have people who come to us and we put them in a proper exercise regimen, and we help their bodies recover. And my roots are Greek, and there is an ancient Greek saying which says the following. I'm going to say it in ancient Greek first, and then I'm going to translate it. Okay.
Okay.
So it says, nous υγιείς en somati υγιές. This means a healthy mind requires a healthy body. So,
very very true. Interesting. Is also, I was going to ask you, are there any dietary supplements or like the coumarin? Are there any of these things that you would recommend for what you were talking about with the COVID?
Well, I'm not going to necessarily discuss protection, vitamin protection from COVID, such as zinc, high doses of vitamin D. But in general, besides somebody taking multivitamin, vitamin B is very good in general for the nervous system. Having a B complex vitamin would be very, very important. But also vitamin E helps with the joints. And there are other things also, but may not be very much available to everybody. Looking at making sure, especially now that it's summertime, people having enough potassium in their diet is important. Not getting very much dehydrated. When you get dehydrated, the joints become less lubricated, so you get more pain. So, and that.
Thank you. Well,
You're welcome.
We're coming near the end of the show, and I wanted to ask you if you had a last statement or something, a message that you would like our viewers to take home with them.
Yeah. I can give a lot of messages here, but I will give you something that perhaps is the most important for me, which is the following. It is very important for someone, in order to make the right decisions in their lives, in order for someone to lead a healthy life, to have healthy relationships, that they have clear thinking. Clear thinking is not possible when people take heavy doses of medications, especially, opioids. And I totally understand. I totally understand. Some of you may be suffering from pains and aches, and a friend, even a doctor, gave you these opioids. Well, you know what? Look for some other solutions. It's not necessary that opioids are the solution. Look for some other solutions, because perhaps if the right cause of the problem is being identified, then you may be able to solve the problem with the help of a proper provider who can help you without medications to resolve the issue, feel better, and then feel more vibrant and feel freer and healthier.
Very, 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 very sound advice, and very to the point. And after watching and listening to you in the show, definitely you would be one of those providers. They can reach out to you. I want to thank you for being on the show.
And thank you for everything that you do, because what you do is amazing and it helps a lot of people. So thank you.
Well, together, you know what? The whole purpose of this show is truth. And the truth that I want to leave you all with today, we all do so much. Let's take a look at what all of us do. Let's work more together. Let's preserve what we have. And until the next show, have a great week. And this is Dr. Bernard Fialco from Time for Truth. Be well.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. Let your feet